So today we are going to learn about pharmaceutical legislation. So what is legislation? Law intends for regulation and control of various aspects of life. These aspects might be social, economical, and political. Pharmaceutical legislation is a mixed legislation which overlappingly covers both social and economical aspects. Objective of pharmaceutical legislation. Its main objective is to ensure that the patient receives drug of required quality, tested and evaluated for safety as well as efficacy for their intended use. Pharmaceutical legislation is associated with the law health of the society. Origin. So from where the pharmaceutical legislation come into a region. In 1811, first chemist shop opened by Mr. Bathgate, who came to India with East India Company in Calcutta. In 1910, they have started manufacturing of tincture and spirits. In 1821, another firm, Smith Stanstreet and Corporation, started apothecary shop and started manufacturing in 1918. In 1901, Bengal Chemical and Pharmaceutical Works, a small factory, was started in Calcutta by Acharya P.C. Rai. And in 1903, Professor T.K. Gajar opens small factory at Parel for the development of pharmaceutical units and Alembic Chemical Works Limited at Baroda. These units were not sufficient to fulfill the needs of Indian public. Hence, most of the medicines were being imported from abroad, mainly from UK, France and Germany. And in World War I, the need was improved. The demand of indigenous drugs was also improved. Competition becomes unhealthy and Indian market flooded with the inferior, substandard and even harmful drugs. So for all these reasons, the committee was established which controls or evaluate the condition of drug or standards of drugs, which was appointed by Indian government in 1931. The committee chairman was Colonel R. N. Chopra. So the Drug Enquiry Committee, also known by the name of its chairman, Chopra Committee or DEC. So what's the main working of this committee was? The committee was asked to make inquiries in the said matter and then to make recommendations for smooth control of manufacture, import, distribution and sale of the drugs in the interest of public health. Recommendations of DEC. So Drug Inquiry Committee gives some recommendations. 90 recommendations were reported was submitted by the committee. So there are some few important recommendations that we are going to discuss here. So first recommendation was formation of Central Pharmacy Council and State Pharmacy Council, which would look after the education and training of professionals. Council would maintain the register containing names and addresses of the registered pharmacists. So second recommendation was creation of drug control machinery departments at the center and the branches in all states. Third recommendation was establishment of a well-equipped central drug laboratory with competent staff and experts for an efficient and speedy working of drug control department. Small laboratories would work under its guidance. Drug bill. So what was drug bill? Because of reluctant approach of government towards the implementation of the recommendation of DEC, public pursued the government. Okay, so the DEC was not fully sufficient to implement their rules, recommendations. So there was a bill passed by the government. Ultimately, in 1937, import of drug bill was introduced in Legislative Assembly to control the imports of the drugs. However, the manufacture, sale, and distribution of drug was not included in bill. So, firstly, there was only in this bill was what the topic was import of drug only, not and there was nothing mentioned about manufacturing, sale, distribution of the drugs or any standard of the drug. They have nothing about this in this bill. Next, committee forced the government to include all these aspects. As a result, in 1940, so in 1937, there was no including of manufacturing, sale, and distribution of drug. But in 1940, drug bill was again introduced in assembly. Drug Bill 1940 was passed. It came into force as Drug Act 1940. Later on, it was amended many times, and at present, the Act covers provisional related to drugs, cosmetics, Ayurvedic, Unani, and homeopathy medicine as well. The present Drugs and Cosmetic Act is an improved version of Drug Act 1940, which has the objective to control import, manufacture, distribution, and sale of drugs and cosmetics. Central government has made many rules for the same and presented it as Drug and Cosmetic Rule 1945. This act and rule were amended from time to time. Other important acts are after independence in 1947, the other acts were also intact as per recommendations of DEC. That was Pharmacy Act, the Drug and Magic Remedies Act, Medicinal and Toilet Preparation Act, Drug Price Control Order unchanged at 1987, Narcotics, Drugs and Psychotropic Drugs Substances. Thank you.